The expressed views, statements, and opinions by the guests on the Risk Advisor program made either during the show or on the corresponding social media and blog outlets are not necessarily the view or opinions of Baxter Productions, Inc. or any of its affiliates, associates, or others who are part of this production. Information provided during this broadcast is for news purposes only and does not constitute a remedy for any of the discussed risks presented.
Did you ever wonder about the internet and medical diagnoses and the problems and issues that all of those things come up with? How's the web changed medical practice today? Well, that's today's topic on theriskadvisor.com.
The Risk Advisor. You're listening to the Risk Advisor Vodcast. The Risk Advisor highlights topics about the most important personal security and safety issues today. This is for you, your family, and your loved ones. Experts alert to trends, tactics, and techniques used against us. You can be more aware and more informed to stay safe in this ever-changing, complicated place we call life. And now your host, media's go-to guy, Sal LaFriere.
Welcome to theriskadvisor.com. We're here back again with Dr. Maria LoTempio. Dr. LoTempio is a double board certified surgeon in plastic and reconstructive surgery and head and neck surgery. She graduated from the State University of New York at Buffalo School of Medicine and is such a fan with our audience that we had to have her back again. And by the way, one more visit and you're going to be a co-host. Okay, just saying. 2 more visits and I'm going to be out of a job. So, welcome back.
You know, it's always great to be here.
I'm glad you feel that way.
I am. I enjoy it.
So in the summer when I go away for vacation,
I'll
you
just
can
take
take over.
I'll take over.
You got this.
Not a problem.
Actually, we should do a show for you.
Yeah.
Have your own show.
That's right.
All right. Let's talk about today. We wanted to talk about dealing with the internet and medical diagnoses and the problems and issues that all of those things come up with. How's the web changed medical practice today?
Oh, gosh. How much time do we have? Let's talk about the positives. The positives from the web is that we have the ability to find out a lot more information than we ever have. We can break down diseases and understand the concepts. We can understand the physiology, the pathophysiology. We could understand the signs and symptoms, the treatments, surgeries, medications. And that individual that is really the researcher can get all that information on the web.
But the information that we're getting from the web has a possibility. I mean, it's sort of fraught with danger, right?
It is.
There's misinformation, there's potential misuse, there's the manipulation to make it be what I want it to be.
Of course.
Right? Talk to me a little bit about how some of the information can get sort of misinterpreted.
Well, I think we have a tendency, not we, but when you look at an ailment, a disease process, we have a tendency to list in writing every possible scenario. And oftentimes that can really confuse the patient, or better yet, scare the patient to the point where they will stop their medications, stop their treatments, decide not to go ahead with their surgeries. So sometimes the saying goes is ignorance is bliss. If they don't need to know the ins and outs, sometimes it's better off. As a physician, our job is to put people at ease. Our job is to understand what the main problems are with their disease states and the treatments. But when they go and they read every single solitary problem, it can cause a real conflict of interest.
Do you find people using the web more for diagnosis or treatment?
I think everything.
A little bit of both.
I mean, I have, people that have never had a single course in any kind of science, and they come to me with information that I just look at them in awe. Dr. Google answers all.
Did I ever surprise you and find something that you really didn't know about?
It's not that I don't know about it, it's the fact that they actually picked up on it. My job is to know everything as much as I can. That's why medical school and training is a lengthy process, but for them to read it once or twice and pick up on some of the nuances, I find they're quite clever.
Do they ever battle you on the treatment and say, well, no, the prescribed treatment, you tell them take this for whatever, and they come back and no, 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 it's, but the prescribed treatment is supposed to be.
Well, I don't get that often in the sense, and especially here in the U.S. I've gotten a little bit more pushback when I've worked outside the country with other cultures. But here, generally, they may say, hey, I like this and that, why don't you do that? And my answers are usually researchable. And I give them the information, and once I give them that information, they seem quite fulfilled in the answer, and they're like, okay, I'll listen to you.
Talking about outside the country, one of the things that has been written about the internet and the medical side of the internet is that it gives the opportunity to bring medical care to underserved areas.
Right, and I think and again, when we talk about positive and negatives, and unfortunately I always tell patients there's always a pro and con for everything we decide and everything we take. But one of the pros with telemedicine and with the internet is people that are in these remote communities that don't have access to the cutting edge technology and treatment. The telemedicine actually will provide these physicians that are working in these environments with answers that they may not have at their fingertips. So I think many major medical universities here in New York City have a telemedicine program to underserved cultures, regions, countries, to be able to help those physicians in those areas. So it's quite wonderful.
And it's also a resource for doctors.
And generally that's what it is. I mean, it's really for doctor to doctor, nurse to nurse, pharmacist to pharmacist, to really kind of give that individual the support that they need that they wouldn't have at a major university hospital. So telemedicine gives that support.
So obviously anybody that has spent any time on social media or online and on the web winds up seeing all of these ads for, buying medications at, different pharmacies, and you can go across the country and there are all these different places that'll fill a prescription. Some will even have a doctor talk to you on the phone or do a FaceTime and then issue you the prescription, right? Is that problematic? I mean, in a prior episode, we talked about having the conversation with the pharmacist as being sort of the point person who recognizes all of the meds that you're really on and what you're taking and any of the over-the-counter stuff or vitamins and stuff. So as that person being sort of the point person, now all of a sudden you're introducing maybe 1, 2, 3 different pharmacies. Does that cause a problem?
It does. I think the impetus for individuals to really reach out to these online pharmacies is a cost issue. If anyone can save a few dollars in today's times, why not? So the online pharmacies can offer that. However, though, when you start doing that and you start taking in a bunch of medications that are not under, in a sense, a single umbrella, your pharmacist or your doctor, then we're going to be encountering more risks such as complications from the medications becoming ineffective because they're being taken with another medication. So if you were to entertain that idea, let your pharmacist know and let your physician know.
And obviously, what you don't want to do is if you did wind up starting to get into interactions and becomes problematic, you don't want to keep it a secret, and you don't want to do your own diagnosis of it.
Correct.
Because problems just get worse and worse and worse.
Correct.
Okay, when we come back, we're going to talk about what hypochondria is and what question you should be asking. We'll be right back.
Hi, my name is Dr. Maria LoTempio. I'm a plastic and reconstructive surgeon here in New York City with an office in the Middle East. I always knew I wanted to be a surgeon, even at age 6. But it wasn't until medical school that I knew what area of surgery I wanted to go into, and that was head and neck surgery. The anatomy was challenging, and I enjoyed every aspect of it. But during my residency as a head and neck surgeon, I realized that I also enjoyed the reconstruction and the aesthetics component. From there, I was able to learn how to take care of and perform surgery on all age groups, men, women, and children.
Dr. Tempio was very knowledgeable in procedure. She told me everything I need to know about aftercare, about the procedure, the expectations, and she was great.
If you're looking for a change, come to our practice. Sit down, have a conversation, and let me see how I can help you.
Welcome back to the Risk Advisors Show. We're here with Dr. Maria LoTempio, a board-certified New York-based plastic surgeon, and we want to talk a little bit about cyberchondria. And I know when I brought this up to you, you looked at me and you went, "Really, cyberchondria?" It's got to be true because it was on the web.
And I love that answer.
It was on the web.
Of course it's true. It's on the web. It's written on paper. Of course it's true.
If the web said it, it's got to be true. I'm not sure if it's in Webster's dictionary yet, but I'm sure it'll get there if it hasn't. Talk about, obviously you get patients that are hypochondriacs, right, that come in and that they think they have every disease known to man. Right? Now you got somebody who's actually going online and doing the same thing. Talk about hypochondria, maybe not necessarily cyberchondria.
Well, I don't necessarily interact with those patients as often nowadays as a plastic surgeon. I more have the plastic surgery hypochondriacs, which is getting more and more procedures. But individuals that have a tendency to want to research and worry about certain things have the ability to read a sentence or a paragraph and subjectively say, hey, look, I have all those symptoms. And that becomes a problem because maybe they have had all those symptoms at one point in their life, but they don't necessarily have all those symptoms now. They don't necessarily know exactly what the symptom means. They can interpret it differently. So it becomes a little bit of a gray area when somebody comes in and says, I read this and this is me. It's 100% me. I know it, work me up for it. And in those scenarios, I'm actually putting a person's, mentality and thought process at ease versus having them physically being treated for an ailment, because they may or may not have that ailment, but they're so fixated on it.
This gets us slightly off the topic, but so a person who is a true hypochondriac that's going to come in, you're identifying that by virtue of the fact of the frequency of what they're coming in and the wide range of ailments that they're having.
True.
It's
right. And, I don't deal with those types of patients, as I said, that often anymore. Really, that's the primary care doctor. And if there is a psychological component, then it's really the therapist that needs to take over at that point. So this could be an indication that there is a more severe psychiatric problem underlying, and that the doctor may just be dismissing because they're reading and they're thinking about all these things that in the doctor's mind may not be true, but this again could be an indication that there is something more going on and that individual may need to see a psychiatrist.
Talk to us a little bit about the good uses of, or the proper uses of, the Google searches, the being able to get a doctor on FaceTime and things along, WebMD. What are the good things out of that?
I like WebMD because I think its information is in a very objective format. It will educate the consumer if you're trying to decide certain things to do. Not all decisions are that easily made by the doctor or the patient when they have a disease process that needs to be treated, especially if there's cancer involved. There's a lot of different drugs, there are a lot of different treatments, a lot of different procedures, and I think that looking at those websites will help that patient understand the difference between radiation and chemotherapy, surgery, surgical procedures, which may explain to them in a more of a layman's term versus when they have the 5-minute conversation with the doctor and they walk out not really understanding fully what that doctor had just said to them. They can go back and they can read it and they could actually digest it properly.
I have a friend of mine down in Florida that actually has a practice that's all online.
Right,
and
concierge doctor. Yeah.
It's the concierge doctor, and a lot of what she's doing is dealing with nutrition and dealing with supplements and vitamins and
right. Yes.
and that sort of stuff.
And I think there's a role for those doctors in today's society. I think that medicine is expanding into different fields because of technology. We are able to get into different cultures, different countries, and I think that's wonderful if individuals are seeking out that type of care.
The next question sort of leads us into what I want to talk about next, but how much research should somebody do, or what is it a good practice if you're going to travel abroad to be able to go online and recognize what's going on in the country or what the potential problems might be? How do you prepare for that travel?
To undergo a medical procedure,
Just in general, if you're going to, we'll get into medical tourism in a little bit, but if someone's going to travel, you're going to go to a part of the world that you haven't been before, or you're just not that familiar with. How important is it to sort of understand what you may be running into? I guess the similarity that I'm making here is Mexico.
Right.
Right. You want to bring an antidiarrheal with you if you're going to Mexico.
So I think it's important to understand the area that you're going into, what disease processes, infections are in those areas, and those are easily researchable on the internet. I think it's important that if you have prescription medication that you're on a regular basis, that you take enough. It's very important that you never put medication under the plane, always on the carry-on. And the diabetics, unfortunately, the needles need to go underneath the plane at times. But those are things, you always want your medications with you when you travel to a foreign country. On the off chance your medication's lost, destroyed, at least you have access to it directly. Let's say that actually does happen. Most hotels and resorts and places that are reputable will have a doctor that is associated with the hotel or the property, which is going to be your point person for you getting the medications that you need.
Which is interesting because normally, we tell people on the security side, if you go into, to a foreign country, and if there's an embassy or a consulate there, register with the State Department and let them know that you're there. Never realized that the hospital, that hotels would actually have doctors that, if you ran into those problems, that you could go to them and use that as a resource.
Absolutely. The larger and more reputable chains do.
Interesting.
Especially in those countries such as Mexico, the Caribbean, India, Middle East, all over Europe. I mean, they all have doctors associated with these higher end properties or reputable chains.
Interesting. Okay. When we come back, we want to talk about medical tourism. What is it and the possible dangers that exist? We'll be right back.
Workplace violence, terrorism, identity theft, cyberbullying, and stalking. It's not a matter of if they will happen, it's a matter of when. The security world is too complicated to do it alone. You need a security advisor. Call Protective Countermeasures now. Protective Countermeasures has been providing security consulting to Fortune 500 companies for nearly 20 years. Call today, 914-576-8706, protectivecountermeasures.com.
You're watching The Risk Advisor, and we're back with Dr. Maria LoTempio talking about medical tourism, what it is, and the possible dangers that exist. So let's talk. We started talking about medical tourism before, and we're including it as somebody that has gone for a procedure, decided to go overseas to get the procedure done at a reduced cost, and some of those issues that'll pop up. You also have somebody who's over as it turns into medical tourism when they're involved in a car accident or injured in a way or wind up with some medical malady. So let's talk a little bit about, the sort of highlight the things that become problematic. So first and foremost, infection.
Right. So, in the United States, infection is a big problem. And we have many criterias by which the hospitals, the ambulatory centers, surgeons, staff all have to do to minimize infection. Even the patient has responsibilities to minimize infections. When you go abroad, those standards become abstract because we don't really know what their standards are. And because of that, individuals could be more susceptible to certain types of infections in those environments.
Medication dangers. Some of the medications that you get overseas may not be made up as within the same compounds or same elements of in the medications that you're familiar with here.
True. So we have no idea as a physician, and you have no idea as a consumer how that medication is made, how it's processed, and what's actually in it.
Communications issues was the next point, and that was you're in a foreign land. How do you really explain, what's lost in translation? Is there a possibility?
Well, of course there is, and I think it's always a must is to have a translator with you whenever there's a medical problem going on.
I mean, it's obviously if you're a victim in a car accident and you got a bone sticking out of your leg, then obviously you don't have to explain much. It's pretty evident what you have, right?
Right.
But it's when those, when you have the pain in the stomach or things that are not easily identifiable, are the things that I think you start to have some difficulties trying to explain.
Right. So if you, again, go to a reputable healthcare facility, they should have proper translators available to you. Again, if you're traveling and you're staying in certain properties, they should have a physician available to you that understands the language and understands the medical terminology. I think those are things that you want to look for.
And I think that one of it is probably, as an aside, is the insurance issue of are you going to be covered? Is your insurance going to cover any of this? And how are you going to deal with all of those issues that pop up?
Well, honestly, at that point, you're in a foreign country and you have a major medical problem. I think that's the least of your worries.
Blood supply issues. Let's talk about that.
So, trauma, you're going to these great places, you're doing all these wonderful tours, you're doing these activities that you might not normally do. You may have an accident that results in a major trauma, and you may need blood. And one of the things that, as a consumer and as a patient, you should be fully aware of the type of blood that you're receiving, the lot number, the expiration of that particular blood. You want to know where that blood came from, and you want to have a paper trail. You also, blood should not be given in any situation lightly. So unless it's warranted, a medical emergency, one should try not to have a blood transfusion. But by saying that statement, if a physician is saying to you, you need a transfusion, you also need to listen to that physician, regardless of what country you're in, because it probably is a life-threatening issue for that physician to say that to you.
In the United States, and I'm assuming the American Red Cross who does the blood drives here, does all of that tracking and keeps all of the paper trail going.
They do, but all the hospitals do. Every place in the United States, we can trace that blood back as far as it can go. We know when it was taken. We know the medical ailments that patient may or may not have. We know to the point where what time the blood was taken, how the blood was processed. All that information is available here in the U.S.
But if you're in the middle of nowhere, and you're on a safari, or you're somewhere where you're just in the middle of nowhere, you're 2 to 3 hours away from a medical facility.
Right.
We're not necessarily sure that the medical standards, if we go back to the point on infection, we're not exactly sure how everything is. You run into that same problem, don't you, that they didn't keep the blood on ice for a period of time?
But at that point,
that's all you got, Dave.
If that's what they're entertaining, then that's a serious situation, and you're going to just have to do what needs to be done at that point. You're not in a position to say that, I'm going to wait 3 hours if you're on the verge of dying. And if someone is making that call, you need to listen and you need to understand that. Unfortunately, not all situations are ideal, and when you recover from that situation, then you can inquire about all those detailed information that we just talked about. But if it's a true trauma situation, the goal of the trauma situation is to have you survive, is to get you over that problem. This is not an elective procedure. This is not an elective moment. This is a true emergency. And at that point, you have to relinquish the power to the individual that has the experience and knowledge that you do not have.
We talked about offline about blood testing, about what we're testing for today and what we're comfortable with today, and the possibility that somewhere downrange we may find something that's problematic.
Yeah, it's always true with anything. Any medications that we give, any kind of blood products that we give, we test everything here for things that are available. But, 15, 20 years, technology is going to change, and we're going to be able to pick up more disease states, and more details are going to be available. And unfortunately, people that have undergone transfusions or certain types of medicine, they may be exposed and they may have problems in the future.
Real quick, 30 seconds, when you've had this medical issue and now it's turned into medical tourism and you have to travel home, what's one of the key things that you have to be cautious of or careful of as you're traveling, with just on the air flight but coming back?
Just in general?
In general. Is infection a major part of?
So you need to be aware what you had. You need to know what the risks and the complications are. Infection usually starts off with fever, chills, nausea and vomiting, redness at the site, hotness to touch, any kind of diarrhea, any kind of shortness of breath. Any of those things, immediately go to the emergency room as soon as you get back to the United States.
Okay. Well, once again, thank you for joining us, and thank you to our guest, Dr. Maria LoTempio. We'd like to remind you, if you have a question or a comment, you can feel free to write to us at questions@theriskadvisor.com, or you could follow us on our social media accounts that you could find on our website at theriskadvisor.com. And real quickly, your website is?
LoTempioPlasticSurgery.com.
Okay. It was a trick question to see if she was paying attention. Thanks again for watching. We hope you tune in next week. Bye.
We hope you enjoyed this show. If you have any questions, would like to appear on the program, or recommend a guest, contact us at theriskadvisor.com. Follow us on Facebook, Twitter, Instagram, and LinkedIn. View and listen to us on iTunes, iHeartRadio, YouTube, and Roku TV. Tune in live on various local radio stations. Find links to all of these and listen to past shows at theriskadvisor.com. Thank you for listening. Stay safe and join us again next week for another episode of The Risk Advisor.
From the files of New York detective Frank Santasola, a riveting murder mystery novel, The Garbage Murders. After an illicit liaison with his mistress, the owner of a private sanitation company in New York is murdered. Enter the life of Detective Frank Miranda, one of a few men in law enforcement to infiltrate the Italian mob and bring to justice some of the biggest names in organized crime history. On Amazon Books in paperback and Kindle editions.
TheGarbageMurders.com.
TheRiskAdvisor.com.